afternoon, everyone, and welcome back to the Brainy Boomer Lecture Series. We're so very happy you've all joined us today. In 2007, the McGill University Research Center for Studies in Aging, or the MCSA's Education Committee, started the Brainy Boomer Lecture Series in order to suggest practical steps to both improve and maintain brain health, as well as to promote healthy lifestyle choices amongst the most populous generation in history. The MCSA's Education Committee, which was founded in 1996, has three main objectives: identifying education needs of healthcare providers, seniors, caregivers, and the public, and to develop responses to meet some of their needs; to enhance the positive image of the aging process by addressing stereotypes and myths about aging; and finally, the dissemination of research on aging. Your presenters for today are a group of 6 nursing students from McGill. As a requirement to complete their final semester, they have completed a community project with a focus on diabetes management in collaboration with ICCSQ. They look forward to sharing their knowledge and skills with you all today. Before continuing, we would like to remind you to please mute your microphone on Zoom, and that if you have any questions, just wait until the end of the conference, or you could write them down in the chat box on Zoom. And now I'd like to invite our presenters to start their presentation, Diabetes, to join our table to eat and be well.
Good afternoon, everyone. My name is Michael. I am one of the 6 members of my group, and you'll get to see all of our faces a little bit throughout over the next hour. So yes, diabetes, join our table to eat and be well. And we have our names there. Diabetes, it's a big topic. It affects many of us. And I recognize that you all may be here either because you have diabetes, you know someone who has diabetes, or you just want to learn about the topic itself. So we've tried to provide somewhat of a general overview, as well as go into some specifics to try and address the needs that you may all have. A small disclaimer, we are titled nurses who are pursuing further education at a university level. So we have, these are student products, and we've done our best to ensure that the products are accurate and ethical and credible. But by using the products, the user is responsible for any possible errors, omission, and outcomes that can present themselves inadvertently. Today, we're going to go into diabetes, just what it is a little bit, what is a normal blood sugar level, what is hyper and hypoglycemia, being able to recognize the warning signs of each of those, and then go into the management as well, and some diet and exercise health promotion strategies. So, what is type 2 diabetes? It is a chronic disease that causes our body's pancreas, which is an organ in the top right side of your abdomen, to either not produce insulin, to not respond properly, or not respond properly to insulin. And insulin is this hormone produced by the pancreas that allows the blood sugar, the sugar in our blood, to be transported and then given to all the cells in our body for energy. Now, sometimes insulin is carrying around all the sugar in our blood and knocking on all the different cells' doors, says, "Hey, I have energy for you." But then the cells don't respond. They don't open the door. They think it's some random stranger. And so then they don't get energy. And then we end up with problems because our cells in our body don't have energy and all that sugar stays in the blood. And that's a problem too. So we'll get into that. So what is our normal range of blood sugar? We want it to be between 4 and 8 millimoles per liter. That's the unit of measurement that we use. And we want to try and keep it pretty stable in that all the way throughout the day. And there's different strategies to minimize any highs and lows. So maintaining a healthy diet, having a mix of fruits, vegetables, whole grains, having a balance of carbohydrates, proteins, and fats. And we'll get into that later on. Also exercising regularly. By exercising, your body is able to better minimize the possibility of going through highs and lows, as it becomes a lot better at keeping your blood sugar stable. Also, If you are diabetic, then monitoring your blood sugar every day. So you're able to see for yourself, oh, today it's quite high. Tomorrow it's at the right level. Maybe the day after it'll end up being low ones. But you'll be able to see any patterns, and you'll be able to recognize why those patterns are there. And of course, taking your medication, your insulin, if you use it, is very important. Staying hydrated, drink lots and lots of water. That goes good practice for everyone, but especially for diabetics. And also actually practicing stress management techniques. We recognize that, especially with the context of COVID, there's a lot of various stresses on everyone. And so stress can actually cause fluctuations in your blood sugar. And one little tip over here, don't skip meals, because that can cause your blood sugar to drop, which is not ideal. So first, let's go into what causes it to rise. Like I mentioned, there's insulin resistance. So that's when your body cells say, hey, you look weird, we aren't going to let you in. And then all that sugar stays in your blood. It doesn't go into the cells. And then you eat something, and it just stays in all that sugar stays in your blood, and it goes higher and higher and higher. So then, yes, diet, the foods that we eat, different foods will cause your blood sugar to rise faster than others. And it all gets broken down into sugars that get transported into our blood. And like I mentioned, stress and cold. So stress does allow the possibility of becoming hyperglycemic, and being ill can also affect your blood sugar levels. And diabetes has many effects on different organs of the body. I know this slide is a little small, so I'm going to try and zoom in a bit here so it'll be easier to read for the moment. There we go. So for your heart, those who have diabetes are at an increased risk of experiencing an earlier onset of macrovascular complications, and have 2 to 3 times the risk of heart and cerebrovascular disease than those without diabetes. And that's some big fancy medical words, but basically stating that if you have diabetes, any heart conditions or conditions that will affect your blood vessels, you'll be at a higher risk for. In your kidneys, chronic hyperglycemia can cause complications that will damage the vessels within your kidneys and affect your ability to filtrate and produce and release urine properly. In your feet, chronic hyperglycemia can lead to the loss of the protective sensation. So then you might end up stepping on something sharp like a nail, and you won't even feel it. And then you'll bleed, you might get an infection. So it's very important to wear good protective footwear if you're a diabetic, and to always check your feet regularly. Your eyes. Chronic hyperglycemia can cause damage to the retinas and actually lead to a form of blindness. And finally, your brain. So similar to the heart, the vessels in your brain can also get affected and you'll be at increased risk of conditions that will affect your brain as well. So a little review question, and there will be several of these throughout the presentation, so we really value your participation. So if you just use a chat function and type back, what is the normal range of blood sugar? I'll give you a minute to respond. So Quetta said 5. Maria says between 4 and 8. Jamila agrees with her. .3, 4 to 8 from Shirley. I'll give a few more seconds for anyone who might still be typing. Danielle also says 4 to 8. Perfect. Yeah, exactly. There we go. So yes, the answer is 4 to 8. That is the ideal range. So anything, a couple of you put in values that fell within there, and those would be ideal values. But in terms of the range, we do want to see from 4 to 8 millimoles per liter. So then we talk about hyperglycemia. So hyperglycemia is when your blood sugar goes anywhere above 8.0 millimoles per liter. And there are complications that can result from it, and we'll get into that. But of course, we want you to be able to recognize when you might be hyperglycemic. So we've listed some signs and symptoms here. Your mouth might be dry. You'll have increased thirst. You'll feel the need to drink a lot of water. You'll feel weaker and tired. You'll have a headache. You might end up with some blurred vision, and you'll feel the need to go to the bathroom frequently to urinate. You may have just a couple or all of them, depending how hyperglycemic you are. What can cause hyperglycemia? Like I said before, being sick. So when you're sick, that stresses your body, and that can result in the release of a hormone called a corticosteroid, which will cause the body to release more sugar out of your cells back into the blood. Other things that can cause hyperglycemia is if you aren't taking your medications as prescribed, because your medications will help keep your blood sugar stable. So when you don't, then it will rise. Any inactivity, emotional and physical stress, and eating food that is too high in sugar. And we'll talk about a few of those later on. So how do we manage diabetes when you're sick to prevent hyperglycemia? Well, it's important to continue following your regular meal plan, while increase intake of non-carbohydrate containing liquids such as broth, water, and decaffeinated drinks. You should keep taking your medications or insulin exactly as your doctor has prescribed for you. So being sick will increase the amount of glucose in your blood. And so the next step, checking your blood glucose at least every 4 hours is important, because you may see some fluctuations that you wouldn't normally have when you are feeling well. And perhaps it might, you might not even, your appetite might be affected. So then what you eat won't be the same, and that will affect your blood sugar levels. So another reason to keep checking it regularly. If you are vomiting and can't keep anything down, then you should contact a healthcare professional, ideally your doctor or a pharmacist. But if you are vomiting frequently, such as more than 2 times in 12 hours, then it's best to call 811. That's the number for InfoSante. And tell them about your symptoms, what's been going on, and they'll help you make a decision on what is the best thing for you to do if you need to, if you should stay at home or seek further help. In terms of just generally preventing hyperglycemia, like I said, take your diabetic medications as prescribed. However, if you notice that your sugar's having times where it's getting closer to 11 millimoles per liter, so 11 is already above the normal range of 8, but it's kind of this value that we use that is a little bit more of like a okay, we're getting into a red zone here. So, and especially if you have symptoms as well, then you want to write that down, record your blood sugar, the date and the time, and talk to your doctor again and say, hey, I've noticed it was this high. Can we look over my medications? Maybe they'll need to prescribe something stronger or change something about your regimen, or they can work that out with you. Addressing any inactivity, so getting some exercise, getting up, moving regularly, going out for walks is a great way to prevent hyperglycemia. Managing your emotional and physical stress. So everyone has different techniques that they use to manage their stress, whether it's through relaxation techniques like meditation or talking to a friend or going to therapy, depending what it is, then doing those will help prevent hyperglycemia. And avoid eating food that is too high in sugar. So if you are experiencing hyperglycemic symptoms, you'll first know this by measuring your blood sugar using your glucometer. And if it is above 8 millimoles per liter, then the first thing that you should do is follow your diabetic regimen as prescribed. So your doctor should have worked out a plan with you. If either you're just to take medications at set points of the day, then you take them at those times. Or if you're on insulin, then you might have a scale. So if your blood sugar falls within a certain value, then you have to take a certain amount of insulin. So follow all those instructions that you already have been told. Now, if you have no symptoms, but you take your medications, you do everything as you're supposed to do, and your blood sugar stays high, then call 811. That's InfoSante. However, if you're experiencing symptoms of hyperglycemia and they don't resolve by following your regimen, then call 911, because that might be a bit more of an emergency situation. Either way, whether you're calling 811 or 911, then follow their instructions. And finally, once the situation is resolved, then inform your doctor of those hyperglycemic episodes, and they'll work with you to make any necessary adjustments. And now Sarah will talk about hypoglycemia.
Hi, yes. So just like Michael just said, my name is Sarah. I am part of this team. So when it comes to hypoglycemia, it's like the name suggests, when your sugar, it goes too low. So in this case, we're talking less than 4 millimoles per liter. And like you can see on the screen, you might experience some of these symptoms. So sweating, you might feel hungry, you might feel like you're very shaky, dizzy. You might feel like you have a very fast heartbeat. Like normally we don't feel our heartbeat, but in those instances, you'll start feeling it because it'll be going a lot faster than usual. You might feel anxious or sleepy, or a combination of all of these that you see. Okay, so moving on to the next screen. What can cause hypoglycemia? Drinking alcohol can cause hypoglycemia. So especially if you drink some without food or in too big amounts. Not eating enough. Like Michael said, it's really important, especially when you're taking medications, to not skip meals and to take them at the appropriate time. Taking too much diabetic medication. So for example, if the dose is too high or something in your regimen changed and now you might need a little bit less of diabetic medication, if you're still taking too much, that might cause some signs and some hypoglycemic episodes. Sorry about that. Thank you. And if, like I mentioned earlier, if you take your diabetic medications or food at the wrong times, that might also cause hypoglycemic episodes. So they might be the right dose, but if, for example, if you take them late or if you take them too early, the peaks of the medication might not align when you're taking the food. So that's why taking them at the right time regularly is extremely important. Some medications also. So for example, if something happens, you get an infection or something else occurs, and your doctor your doctor prescribes you a new medication, that medication might interact with your might affect your sugar a little bit. Which is why it's really important to talk to your doctor or pharmacist whenever you want to start a new vitamin, a new supplement, or a new when something new comes along. And too much exercise is great for diabetes, and it's super, super important to really help manage it, short term and long term. But if you do too much exercise without monitoring yourself properly, that can also cause major fluctuations in your sugar, which we do not want. So how do we prevent it? So like I said, ideally don't drink alcohol. If you're going to drink some, because that's the reality of the world, then definitely drink as little as possible and drink it with eating, never alone. If you're not eating enough, for example, if you have a small appetite, it can happen. You can eat smaller portions more often, and you can check your blood sugar too using your machines. Like I said, for the diabetic medications and the food, just really making sure that you establish a routine that works with your medication regarding the timing, and that you stick to that routine. And also weight loss, because as we all know, medications also relate with the weight. So if you lose a lot of weight, the dose of medication might become too much for you, or if you take weight, it might become too little for you. So keeping an eye on that is really important. And if you are planning on losing weight, I would strongly recommend talking to your doctor so he can do some more follow-ups with you and medication adjustments. Other things, like I mentioned earlier, some medication supplements and natural remedies can affect your sugar. My strongest recommendation, because we know sometimes we don't always have direct or very fast access to our doctors, the pharmacist is very easily accessible, and they are usually very, very knowledgeable on medications, especially if it's your regular pharmacist that knows your file. So he or she will be able to untangle which medications will have which effects, if they're safe, and if they will have an effect, how to better manage those effects so they're not they won't cause too much of an inconvenience or too many symptoms. Like I said earlier, too much exercise without proper management. We'll talk even more on this later. And another really important factor that I can't stress enough is to always carry a form of sugar on you. Glucose is another word for sugar. So that if you do experience an episode of hypoglycemia, they can happen, you can treat it very quickly. Some forms of sugar or glucose it can be either glucose tabs that you can buy at the pharmacy. They come in different strengths, so just check on the bottle or ask your pharmacist. He'll tell you how many to take when you have glycemic episodes. Of soft drink or juice, for example, 125 milliliters, which is the equivalent to a small styrofoam cup of apple or orange juice, usually is equivalent to around 15 grams, or sugar or candy. For example, 4 lifesavers, which are very easy candies to carry around, are equivalent to around 14 grams. So those are very good options to carry. Okay, so what do you do if you're experiencing hypoglycemic episode? First, if you have a blood sugar machine, take your sugar to see how low you are, to see where you are, and to confirm that's also what's happening. If it is before 4 millimoles per liter, then what I would recommend is that little piece of candy or that source of sugar I was telling you about earlier, to take it. Okay, and it's really important to take it, and then recheck your sugar after 15 minutes. And the types of sugars I was telling you about are sugars that are what we call simple carbohydrates. So they're going to be absorbed in your body very, very fast. So within 15 minutes, you should see an impact on that. If your sugar is still low after when you recheck your sugar, if the sugar is still below 4, repeat the process until it is above 4 millimoles per liter. And once it is, take a meal or a snack, a healthy meal or snack, for example, that contains proteins or vegetables and stuff like that, that's going to help really prevent your sugar from dropping back down once the fast acting sugars have left your system, because they act really fast, but they don't stay in the body for very long. They cause just a spike and then they go down just as fast. So next slide. When do you need emergency help? So that's when your sugar, when it's very severe. So whenever it's, for example, if your sugar falls really, really too low, you can actually pass out or get very close to it. And that can make it so you have a harder time to manage it by yourself, because if you're very close to passing out, then you won't be able to swallow or to eat things very well. So in those cases, I would strongly advise to call 911 right away. They have other options that they can give you sugar very fast so that they can bring it back to the normal range, and which was going to help you regain consciousness. In those cases, usually it's going to be the family that does it. But if you notice you're very low and you're starting to get to that range, call 911 right away. And if you do have a glucagon kit and you are you know how to use them and you're comfortable using them, those are also an alternative that you can have. Your family members can also know where it is and also be trained into using them, so that can help. And for the family, it's very good to let them know that if they do see an episode like this to happen, they need to stay with you. Make sure your body is safe, that you will stay safe until the emergency services arrive. Okay, and if you have more than one episode that happen more frequently, definitely let your doctor know, okay? Thank you. Then for a quick question, so there's gonna be more than one, but what are 2 symptoms that you can name in the chat of hypoglycemia? You can say the symptom itself, or you can say there's just a letter, whichever one you're more comfortable with. Okay, so I'm gonna give you guys a bit of time to answer that.
Thirst.
Good, that's a good one. Thirst, do you have a second one, Carol?
Yes. Dizziness.
Beautiful, those are really 2 good ones.
Yeah.
And
that's what I get.
Yeah, I was expecting, the majority of you, we are expecting you to know this because they're very important. And actually, sorry, I lied, Carol. We're going to cover it a bit more later, but thirst is actually a sign. We tricked you with that one. It's actually a sign of hyperglycemia. A good way to remember it, is that your body has so much sugar in it that it's like, okay, no, I don't like this. I'm freaking out. So let me help my body get rid of it. And what's one way of doing that is by drinking a lot of water, so to help your kidneys pee it out. So thirst is actually a sign and symptom of hyperglycemia and not hypo.
Okay.
Dizziness is a very, very good one. And Lillian said C and E. Same thing. C is very good, and E, for the reasons I just, the little trick I gave you is a very good way to remember it. But it is a sign that something is wrong with your sugar, and you should check it, okay, regardless. But it's more of a sign of hyperglycemia rather than hypo. Perfect. So we're going to move on to the next question. And the answer, like my colleague posted in the chat, was actually A, C, and D. So it was hunger, dizziness, and you're gonna feel like your heart is going really fast. So you're gonna feel palpitations. So going on to the next slide. So what is one thing that you should not do when your blood sugar is low? So A is check my blood sugar. B is eat or drink 15 to 20 grams of fast-acting carbohydrate or fast-acting sugar. And those are some examples. C, skip my next dose of diabetic medication so it doesn't happen again. And D, it is eat a balanced meal snack once your blood sugar is back to normal above 4. So I encourage you to say which one out of these is what you should not do when your sugar is low. So Maria said C. I'm going to let some other people answer in the chat or verbally if you're not comfortable with the chat before we move on. Donna also said C. Very good. C. Thank you, Tamila. Yes. Okay. I'm going to give a few. Shirley also said C. Okay. Carol also said C. Danielle C. Beautiful. Okay. I'm going to give maybe 5 seconds left for whoever wanted to answer very quickly towards the end. Okay, perfect. So up to now, everyone is on top of everything. It is C. You do not want to skip your next dose of medication, because that's not just going to stop you from having another low episode. That's just going to cause you to go to the other extreme, and it's going to put you at very high risk of having a hyperglycemia episode, which is not equally as bad. So going on to the next slide. So now my colleague is going to continue on weight management and diabetes.
All right. Hi, everyone. My name is Kristen, and I'm going to be covering the big subject of exercise with my colleague Marjorie. So, how to lose weight and manage diabetes? We suggest to focus on 2 major lifestyle changes that are best for controlling diabetes, which is exercise and diet. But here it's always important to consult your doctor and endocrinologist when you're changing your diabetic treatment care plan to maintain a healthy blood sugar range and to help manage your weight. So moving on, physical activity. There are a bunch of different reasons why we suggest physical activity, and mainly it's because it's a great way to stay healthy as well as to manage your diabetes. It has a bunch of effects on your entire system, including improving cardiorespiratory fitness, improving your blood sugar ranges, decreasing your insulin resistance, improving your cholesterol, decreasing your blood pressure, and helping to maintain your weight loss and your healthy weight. So, why should I exercise? So, regular, consistent exercise can decrease your cell's resistance to insulin and can have a direct effect on lowering your blood sugar levels, cholesterol levels, improving your blood sugar, and improving your blood circulation. It also contributes to a weight loss, which is a big role in improving long-term health and improving diabetes management. How long should we exercise for? We suggest that people with type 2 diabetes should aim to exercise for about 150 minutes each week, spread out for over 3 separate days. And we suggest a moderate intensity aerobic activity like cardio, which includes brisk walking, cycling, or dancing. Exercise and hypoglycemia. So like my colleague Sarah already mentioned, hypoglycemia is a risk when it comes to exercising, especially when you're combining different diabetic medications. So some of them put you at an increased risk for hypoglycemia. So these risks mainly come when you're more physically active than usual, or when you take your medication and you exercise at the peak action of the medication. So when the time where the medication is the most active in your body, and the sugaring lowering effects of your exercise can last up to 48 hours. So it's important to know this. Some drugs that can cause hypoglycemia include different types of insulin, drugs classified as sulfonamides and sulfonylureas, and drugs classified as meglinotides. My colleague Marjorie will continue the rest of the exercise segment.
Hello, everybody. So my name is Marjorie. Now I'm going to talk about how to prevent hypoglycemia when you're someone that's living with diabetes and you want to exercise. So it's important to note that if you are starting or increasing the amount of intensity of your physical activity and are not sure how your body will react, then first it's important to exercise after the meals when your blood glucose level is rising. The second point is to monitor your blood glucose level before, during, and after exercise to see how that amount of exercise affects your body, your blood glucose level at that particular time of the day. And then it's always important that before exercise, if your blood glucose level is less than 5.5, you want to eat a 10 to 15 grams of carbohydrate snacks, such as a small apple or 4 to 6 crackers. And then you want to take your sugar level again, 15 to 30 minutes to see what level you are now. And do not exercise if your blood sugar level is less than 5.5 millimoles per liter, because that you could experience hypoglycemia. So what not to do? You want to avoid exercising if your blood glucose level are very elevated, because this may lead to a temporarily erratic blood glucose level. In other words, exercise can cause our body to release stress hormones, raising our blood sugar level as a result of our energy needs. People with diabetes are at a greater risk since their pancreas is unable to manage their blood sugar efficiently. And then you do not want to ignore signs and symptoms of hyper or hypoglycemia. So now I'm going to talk about some safety tips for physical activities. The first point is it's important to always talk to your doctor if you have been inactive for some time and if you start any exercise program that is more strenuous than brisk walking. The second point is to make sure that you're wearing comfortable and proper fitting shoes. The third point is to always listen to your body, and if you experience shortness of breath or chest pain, it's important to speak to your doctor immediately. The fourth point is if you take insulin or medication that increases your insulin level, it's important to monitor your blood sugar level before, during, and many hours after your activity to see how it affects your blood sugar levels. And the last point is to carry some form of fast-acting carbohydrates with you just in case you need it to treat your low blood sugar, such as glucose tablets or lifesavers. Now I'm going to talk about the different type of physical activities that are beneficial to managing your diabetes and losing weight. The first type is aerobic exercise, such as walking, bicycling, swimming, or jogging. The second type is resistant exercises that are activities that involves brief repetitive exercise with weights, weight machines, resistant bands, or body weights such as doing push-ups. And these exercise increases your muscle strength and endurance. And the last type of exercise is physical flexibility exercises, which are activities that aims to enhance your ability to move through fuller ranges of motion, such as yoga, lower back stretching, and lower leg stretching, and upper body stretching. You could always check out the Brainy Boomer YouTube channel for more exercise activities. Now the question is, what type of physical activities will you try? Let us know in the comment section. I'll give you a couple of minutes. Thank you, Donna, for walking is a really good way. It's a really nice day today, and I think we should all go walking outside today. Yeah, walking in weights. Thank you, Tamila. Cardio, Pilates, and walking. So those are great answers. Thank you for answering the question. So another important factor in managing your diabetes and losing weight is dietary management. I will let my colleagues talk about it more.
So hi everyone, my name is Lydia. I'll be discussing dietary management with my colleague Levat. So diet is very integral in maintaining a healthy weight and also keeping your blood sugar levels within the normal range as discussed. We'd like to advise you that, of course, it's important to discuss with your doctor or consult a dietitian regarding your diet treatment goals in which you want to achieve. However, we're going to offer a few dietary tips and guidelines that we recommend you can follow. So first, to start off with the foods we recommend to avoid. So foods that are very high in sugar. So for example, any sweet food, for example, donuts, maple syrup, chocolate, all of those you try to keep at a minimum. We want to avoid foods high in saturated fats and trans fat, which are typically high in fried foods like French fries, also in butter, and also salamis out there contain a lot of those. You want to avoid high cholesterol, which is found in a lot of red meat, red beefy meat, or egg yolks and margarine as well. And of course, you want to avoid sodium, so high salt intake. So anything that you see that says salted, or for example, in bacon or pizza can contain a high sodium. And you want to be careful with that, especially if you also have another cardiovascular disease such as hypertension. We encourage foods high in fiber, of course. So fiber is a carbohydrate that's not absorbed or digested by the body. It has a lot of nutritional benefits, such as increasing fullness, reducing constipation, and of course, it helps to manage your blood sugar levels by slowing the absorption of it, so you can avoid the episodes of hypo or hyperglycemia. We also encourage having a diet high in vitamins and minerals, which is found in a variety of vegetable, fruits, and grain products. It's great for your immune system, for keeping your energy levels and your overall health status. So portion sizes. So this is really something we like to explain because it's very important to use this plate guide as you see in the image on the right. It lets you know the portion in the 4 food groups known as meats and alternatives, vegetables and fruits, whole grain products, and dairy products. So as you can see from the image, 25% or 1/4 of your plate should contain whole grain products, which include brown rice, quinoa, or barley. The other 25% or 1/4 should be a protein. So it could be fish, it could be lean meat, chicken, lentils. And 50% of your plate, which is half of it, should contain a combination of fruits and vegetables. And alongside, we recommend having water as your drink of choice. Balance is always key, so you always want to keep your carbohydrate, protein, and fats at a good balance in order to achieve a healthy lifestyle. So here are some handy rules. So in order to help with portion sizes, you can use your hand as a serving guide, so you can compare it with your hands. So for example, with grains and starches, 1 portion of grains is equal to about the size of 1 fist. For fruits as well, 1 portion of a fruit is equal to about 1 fist. For veggies, we recommend having about 2 full handfuls of vegetables. For meats and alternatives, 1 portion is equal to about 1 palmful of the thickness and the thickness of your little finger. And lastly, for fats, 1 portion of fat is equal to the tip of your thumb. So it's the much more smaller amount. So here's our first quiz question. It's, can you name the 4 different food groups? So you can either write them on the chat or you can answer verbally if you like. And I'll give you a bit of time for that. So you can go ahead and name 1 if you're not sure of the 4 or all 4. So I see in the chat, Carol said fruits, veggies, carbs, protein. Donna said fruits and vegetables. Yes. Maria said fruits, vegetables, meat and protein, and substitutes. I'll give you guys a little bit more time for those who would like to answer a little bit. Dairy, yes. Danielle said vegetable, fruits, protein, carbohydrates. And Maria added grains. Okay, so all good answers. Oh, Rick said fruits, vegetables, protein, dairy, carbs. Yeah. Shirley, protein, vegetables, carbohydrates. Donna stated protein, grains, fruits, grains, dairy. Yes. Okay, so we'll go to see the answers. So those are all good answers. We saw vegetables and fruits there. We saw some grain products, dairy, and meat alternatives, which the protein, the carbohydrates could be in the meats as well. So very good, everyone. We're gonna go on to the next quick quiz question. What percentage of my plate should consist of fruits and vegetables? So if you guys can say the percentage on the chat, or you can either say it verbally.
Writing. Where's the
So Danielle said 50. Rick
50.
said 50, 50. Very good. Thank you. 50. Yes. Shirley said 50. Dolly said 50%. All great answers. Yes, so the answer is 50% should be fruits and vegetables. Very good. So fruits and vegetables are obviously essential. They're full of vitamins, minerals, water, and fiber. So they're really great to slow down the
Hello?
absorption. Yes?
Yeah, I saw that. I saw that.
Okay, great. So this is the, we can go on to the next slide. And this is the last one for this part. What is not the correct portion size for meats, grains, and fat? So out of A, B, and C, which answer is incorrect? So you can write the letter in the chat of which you think is not the right answer for the portion size. So Donna said A, Rick said A, Carol said A, Maria A as well. I'll give you guys a few more seconds. Danielle said A too. Shirley said A as well.
A.
A, yes. Thank you. Dolly said A, Lillian said A. Great. Yes, so A is the correct answer. That's great. So 50% of your plate should be fruits and vegetables and not the meats and alternatives. So great job, everyone. So now I'm passing it on to my colleague, Levan.
Hi, everyone. My name is Levan. So now we're going to talk about carbohydrates. Carbohydrate is a nutrient that gives energy that we need from food. What it is, essentially, it's for our body to function properly. When we eat carbohydrates, when it's digested, it will be broken down into what we call glucose, which is also known as blood sugar. And that gives energy for our brain, our muscles, and other cells in our body. Now, a lot of people will ask, should we avoid eating it? And the answer is no. Everyone is encouraged to eat a balanced diet of carbohydrates, proteins, and fats all together to have a stable blood sugar level. The key here is to have a good portion control. The reason why we want to combine carbohydrates, protein, and healthy fats is that it will help slow down the absorption of sugar, allowing your blood sugar to be more controlled and more stable. So now we're going to move on with a question. So what is an example of a carbohydrate? A, pasta, B, potatoes, C, soda pop, D, bread, E, corn, or F, milk? I'll give you some time to answer in the chat.
Pasta. A.
Pasta, yes, that's one. So we've got some answer here. Pasta, potato, bread.
Pasta and potato.
Yeah, we all have good answers. I'll give a few more seconds. Donna said all. Okay, so here is a trick question, actually. All the options above are carbohydrates. So this is why it's important to know the type of foods that we eat because we want to have a balanced plate at all times. This is why combining carbohydrate, protein, and healthy fat is the way to go. All right, so can I eat snacks? And the answer is yes, snacks are really useful to help regulate our blood sugar and minimizing all the highs and lows throughout the day. So that's why you have to listen to your body, and eating a small snack when you're hungry can give the proper nutrients and energy that you need. A good rule of thumb is to eat a snack that has about 15 grams of carbohydrate and combining it with a protein and fiber so that you can feel full for a long period of time. Suggested snacks are like veggies, hummus, fruits, and cottage cheese, whole wheat crackers and tuna, almond butter with celery, or oatmeal with fresh fruit. So another quiz question. Which snack would you eat? Option A, dark chocolate cake with strawberries. Option B, whole wheat crackers with fruit, cheese, and hummus. Option C, potato chips. Or option D, white bread with homemade jam. So Dana said B. All right, we have a lot of B over here.
My first choice that I know is very, very bad is dark chocolate cake. But what we learned from you, it should be whole wheat crackers with fruit.
Yeah. Yeah. So like you said, the answer here would be B, whole wheat crackers with fruit, cheese, or hummus. I talk a lot about combining carbohydrates and protein because it helps our body feel full without spiking our blood sugar. The other options are really tasty, they're really good, but they do lead to a quick increase in our blood sugar, and that's not what we want at all. So very good job, everyone. Another question we're gonna ask, on what snacks here would you eat as well? Option A, soda pop. Option B, apple and peanut butter. Option C, flavored yogurt. Or option D, deli meat. So we got B, a lot of B here. We have B or C. I'll give a few more seconds. Okay, we have a lot of B. And the correct answer is B. It's apple and peanut butter. Apples are full of sugar, helps our body to give energy, and combining that with peanut butter helps slow down the absorption of sugar as well. Soda pop flavored yogurts contains a lot of sugar, and it doesn't really help us feel full in the long run. That's why we don't really use that as snacks. They're all, so yeah, the answer is apple and peanut butter. Okay, moving on, I'm going to talk about a bit about the Mediterranean diet. For those who don't know, this diet consists of a generous amount of olive oil as the main culinary fat. It has high intake of plant-derived foods. So we're talking about fruits, vegetables, legumes, nuts and seeds, whole grain cereals. It has a moderate amount of red wine, usually taken with meals. Moderate intake of seafood, poultry, eggs, and dairy products. When I talk about dairy products, it's mostly yogurt and cheese, not whole milk, butter, or cream. It has low consumption of sweets, red and processed meat. So there's a lot of good benefits. The top three here would be that it is beneficial for people with type 2 diabetes because it improves glycemic control, it decreases cardiovascular risk. It has a lot of good nutrients as well. It has high intake in fiber, vitamins, and minerals. And it has a low intake of saturated and trans fatty acids, refined sugars, and starches as well. In this picture here, it really sums up the whole Mediterranean diet, what you have to eat every day, what do you have to eat in moderation. So it's a good picture over here. So moving on, here I wanted to give 2 meal examples just to give an idea of what this diet looks like. So in the first meal plan, we have for breakfast Greek yogurt with blueberries and walnuts. For lunch, it would be salad with cherry tomatoes, olives, and other vegetable of choice. The dressing would be olive oil and vinegar. The dinner here would be broiled salmon with potatoes and brown rice, and you can always add other vegetable of choice as well. For the second meal plan, breakfast would be egg scrambled with a lot of veggies. Lunch, it's pad thai vegetable pitas with hummus. And for dinner, it's slow cooker Mediterranean chicken and chickpea soup. And you can always switch up the vegetable to your taste as well.
Perfect. So I'll take over from here. Just to end off on our presentation, obviously COVID is still very present. We're dealing with it. And having diabetes, because of the poor glycemic control, does put you at an increased risk of developing infections, such as COVID-19. And so if you do develop symptoms, and they become more severe, then you should seek out emergency help. And symptoms can take up to 14 days to appear after exposure. So just keep that in mind if you do become aware that you've been exposed to someone positive for COVID-19. And the best way to protect yourself is to use all the precautions that have been stated many times over for the general public. So wash your hands regularly, wash surfaces. If you need to go out, then wear the mask, but do your best to stay at home and maintain a distance of 2 meters from people outside your household. And of course, now the vaccine is being distributed. So if you're eligible, then I would encourage you to take that opportunity as well. So that brings us to the end of our presentation. We're really thankful for all of you that took the time to join us.
If anybody has any questions, you can either write them down in the chat box on Zoom and I can ask them for you, or you could just unmute yourself and ask them directly to our presenters.
Okay.
It was a very good presentation. Thank you very much. Learned a lot.
Thank you. Thank you. It's very appreciated. And in the name of the group, I also want to remind that it will be posted online through the center. So yeah, I know we gave you guys a lot to think about and a lot of information. So if ever you want to re-listen to it or go back for some information, just to know that it will be posted. This presentation was recorded.
I just noticed you got a really interesting question there about should you be having a gluten-free diet? I think that's really worth answering.
I mean, I think it depends, because some people have chosen gluten-free diets as recommendations for the doctors for their own health because of medical conditions they have. And in that case, I strongly believe your doctor would have also recommended to talk to also a dietitian to really make a personalized meal plan. If it's just because I know at one point it was a trend, a major weight loss trend, I personally don't believe in diets, and I've spoken to many dietitians that say that diets like these don't work. The best way to lose weight is lifestyle changes, so exercise and eating healthy. If, however, you really, let's say you have problem digestions, but you don't have an official diagnosis and you would like to try it, before trying any of these diets that you find online, especially since you guys are diabetics, I would speak to your doctor or dietitian first, because some of these diets you find online can be very harmful for your diabetes and for your glucose control. So, I mean, it really depends. Those diets are very case by case. I'm also seeing Tamila has her hand up physically through the video. I can't see everyone. So if someone else has their hand up, I'm really sorry. It's just because Tamila happened to be in the top section where I can see her. So I hope I answered that question well. And if not, you can ask something more specific in the chat, no problem. If not, I'm going to ask Tamila, what's your question?
Yeah. Thank you. I like very much yogurt, and everybody said, well, low fat, low fat. As somebody told me, one of the doctors, that especially getting older like me, we need a little fat for our brain. So do you suggest 0%, 1%, 2% yogurt? What kind of you suggest?
If you want, I can take this question.
Yes.
So we suggest Greek yogurt is the best, because Greek yogurt also has a lot of protein in it. And protein will help to fuel your body throughout the day rather than normal stirred yogurts. They have a lot of sugar, but not a lot of protein.
Thank you very much. Thank you.
And I just want to add to that, that yes, we said low fat, but like we mentioned earlier in the presentation, portion control is key. We need all these good stuff. Where it's difficult to control is that in our Western diet, in the diet that we have commonly in Canada, it's very, very, very high in salt and fat. So even if you cut back on salt and fat as much as you can, chances are through the products that we eat on a daily basis, you will meet your daily goals. So you don't want to cut anything out completely of your diet. But it's just that since some of these things are so common and so hard to eliminate from our diet and to not pass the daily limit, that's why we're saying cut as much as possible, because we know with our diet, even if you cut as much as possible, you'll still have enough to meet your daily needs. But of course you need fat in your diet, and it's very important for all of us. Just like we said for the carbohydrates, it can be harmful to have too much, but portion control can really help help you stay in that healthy range.
Thank you.
Also, if I might add, you can also choose like healthier fats. I mean, such as nuts, avocados, fatty fish such as salmon, olive oil. So if you're going to select some fats in your diet, make sure you choose the healthier ones. And those are examples of healthy fats.
Thank you. Maria's exactly right. Thank you, Maria, for that.
Perfect. Tara B, you have your hand up. If you'd like to ask your question, you can ask it now.
Yeah, about the normal range for fasting blood sugar, I always thought it was at least below 7. At least my doctor always hammered away at that. So you're saying 8. Well, that makes me feel, of course, that I'm much better off. Where did you get this 8 rather than? I mean, is this? Are you confident that 4 to 8 is a good range?
It's lately the doctors have been lowering the range, and they do want you to be around 7 as the highest or lower than 7. But we do allow a little bit, they do allow a little bit of a leeway, in the older person, and just to make sure that it's an attainable goal as well. They don't want you, they just do allow a little leeway, and those are kind of an older standard, but they do apply to an older population as well, just to give them a bit more leeway. Yeah.
Yeah, I'm gonna say I would listen to your doctor at that point, because you doctor have a relationship where he's probably more aware of your trends of your glucose levels for your body. So we're giving you kind of the good general information, but specifics to your doctor, I think that's better negotiated with him. Yeah.
Okay. Thank you.
Yeah, and that applies to everything in the presentation. If your doctor tells you something that varies from what we said, definitely go with what your doctor said, because he's telling you information based on a case-by-case basis on what would be best for you. Mm-hmm. We're giving you information on the general guidelines for diabetic care and what could apply to everyone. But if you have more specific information from your doctor, dietitian, or pharmacist, definitely go with them. Obviously, if you have any doubts, you can ask them why your ranges vary a bit from what we recommended. But 4 to 7 is I could see why he would say that, like Maria and Adriana expanded on.
Yeah. Okay. Can I make one more comment about? I'm not sure if the person is still in presentation who was talking about the gluten-free diets. There's one thing I wanted to mention. First of all, gluten-free usually refers to people who have celiac disease or some kind of sensitivity to gluten. That has to be diagnosed. That's not something that you can kind of just go ahead and decide. It's a trend diet right now. That's why you see so many gluten-free things in the supermarkets. But it really does need to be diagnosed. Secondly, anything with no gluten in it tends to be higher in sugar, especially those processed foods. So that's another thing you need to be careful about, thinking that maybe somehow, taking the gluten out of your life is going to make things better. It in fact can actually increase your sugar level in all of your foods. It's a protein that normally most people can break down, but people with celiac disease can't. So that's why we're saying try to stay away from those kind of trend diets, because they can actually be more harmful than good.
Mm-hmm.
Perfect. We also have another question here. Somebody would like to know if probiotics are recommended.
That's a great question.
I was going to mention that probiotics are useful for the body to help digestion. If ever you're having troubles with digestion, you have problems with your stool, probiotics are a really useful tool to help regulate your digestive system. So if you include probiotics like yogurts and Greek yogurts, like we mentioned, it can really help to regulate your digestive system.
Yeah, I was going to say, you can get probiotics from your food. You don't necessarily have to buy those little bottles of probiotics that are in the store, because sometimes you don't know what you need for your gut. And so sometimes taking those concentrated bottles can be too much. That can actually create intestinal problems. So better to get your probiotics, as Kristen was saying, from your food, like fermented foods, especially, like I should say fermented, things like yogurt that already have like a bacterial count in them already.
And I see a comment as well from Rick saying to watch the added sugar in yogurt. And I think that's a great comment. And something that I would encourage you to do is buy plain yogurt. Greek yogurt is also generally lower in sugar. And if you want to add any sort of sweetener, then that's something that you can add in yourself of your own choosing. You can select the amount rather than buying a pre-sweetened yogurt. But plain yogurt is definitely better.
So thank you so much, Sarah, Michael, Kristen, Levan, Lydia, and Marjorie for this fantastic presentation. The members of the MCSA Education Committee would like to thank you guys again for the fantastic presentation and everybody who signed up today for the event. Our next event is going to be tomorrow. Our registration is still open. I'll put all the links down in the chat box on Zoom. It's called Aunt Need Gets Help. We really hope to see you all there tomorrow. It's going to be at 1 o'clock. We also have a very exciting nutrition and cooking series that's starting in April. That has also been posted to our Eventbrite page. And we really hope to see you there. It's going to be really, really exciting. We have some fantastic presenters for that as well. And I'm going to bring your attention. I'll put everything down in the chat box on Zoom. We have the link for a short survey. We would love to have your feedback about today's event or any other Brainy Boomer event or Healthly event that you've attended. We also have the link to our YouTube channel in case you've missed an event and would like to watch it or maybe go back and get some more information about today's event. And also, as usual, we have our Eventbrite link. And also, if you'd like to get some more information about MCSA or maybe to make a donation, we have that link down in the chat box as well. So just one more time, thank you everyone for coming today, and I hope you all have a great day.